Being a teenager can be hard,
especially when you have a chronic health condition. A chronic health condition is a medical or mental health condition that lasts 3 months or more and requires ongoing medical attention.
When you have a chronic health condition and you turn 18, you have to move or transition from your pediatric doctor to an adult one. Transition to adult healthcare is the process leading up to and the actual transfer of care from pediatric to adult services.
This transition can be really tricky. It happens at a time when you might be juggling a lot of other new responsibilities or new changes in your life, like graduating from high school or maybe starting a new job or school program.
Based on previous research, we know that this transition period can lead to things like more frequent trips to the emergency room, less frequent appointments with your doctor, and difficulty managing your condition, which might look like more flare-ups with your condition or symptoms. It's really important for researchers to study the transition to adult healthcare because we want to make sure that youth are able to successfully begin their adult life. So, how can we make this transition better?
Well, the Transition Navigator Trial, or TNT, is a research study that is trying to see how we can make this transition from pediatric to adult care smoother. This study is using a patient navigator to assist youth who have chronic health conditions like autism, irritable bowel disease, or diabetes move through this transition. We recruited youth from 3 pediatric sites across Alberta. In this trial, youth work with the patient navigator for 12 to 24 months.
Within TNT, the patient navigator is a social worker. They can help youth with a wide range of things related to their transition. The navigator helps youth prepare for the actual transfer of care, which includes creating a medical passport, learning how to talk about health concerns, assisting in the development of relationships with primary care providers and specialists, and ensuring timely attendance to first adult clinic visits.
The navigator also helps youth develop important skills for adult care, which can include promoting communication and collaboration between youth, their families, and all providers. The navigator can assist youth with social and financial concerns that may create a barrier in accessing necessary medical care.
Lastly, the patient navigator helps youth with the self-management of their medical conditions. Self-management is a big part of transitioning to adult care. This means learning how to take care of yourself and your needs. To assist with this skill development, the navigator provides information and access to tools, educational resources, and peer support opportunities. They can also help youth track their follow-up clinic appointments to make it a bit easier to attend.
So, how does the navigator connect with youth? They reach out to youth via a phone call, text, or email every 3 months. In addition to these scheduled meetings, the youth can also reach out to the navigator at any point if they have concerns or questions about their health, school, or appointments, basically anything related to transition. If the youth goes through an emergency situation like a health crisis or family crisis, the navigator is there to support the youth's needs.
Now that you know a bit about the Transition Navigator Trial, let's hear how youth actually feel the navigator is helping their transition.
Youth who were participants in the trial and received care from the patient navigator said the following regarding their experience.
I absolutely love my transition navigator. I don't know what I'd do without her. It has been a rocky transition, but she's making it a lot less overwhelming.
It has been challenging to transition to adult life, but I have found these check-ins to be immensely helpful.
Having a transitional navigator has made this process much easier and has reduced my stress significantly.
I really love this trial. It has been a lifesaver for me. It will be unfortunate when it ends. Everyone should have access to this. So, what's next?
The navigator role has been implemented at all of the recruitment sites as a result of the TNT. That means a patient navigator service will be available to all youth in Alberta who are transitioning to adult health services with chronic conditions. The trial will be ending soon, and we're working with youth partners to further understand the results of the study and to implement the study's findings into clinical practice to make the transition better for youth with chronic health conditions.